Hi, my name's Dr. Pam Hagan. I'm one of two senior tutors at the Division of Medical Sciences and Graduate Entry Medicine over in Derby. My role is to coordinate the personal tutoring programme for the graduate entry medical students, which involves organising and training about 26 to 30 personal tutors. And each student, when they start the graduate entry medical programme, will be allocated to one personal tutor who will remain their personal tutor throughout the whole 4 years of the course. We obviously encourage the students to have this relationship with their personal tutor, because if you think in advance, it will be the personal tutor that is writing your reference for you. So building a relationship with them is quite important on both sides. But actually students can come to me or Kate to talk about anything that's worrying them, and usually we can help. We usually give them some advice or signpost them to somewhere that can help them. Students can contact us in a variety of ways. We obviously by email. We have an open door policy, so my office is based right at the top of the first flight of stairs, so we have passing traffic all the time. Quite often students will just have a look in the window if I'm there and they pop in, so we have this, they can pop in whenever they want, and as I say, email us. We do respond as quickly as possible, which is usually either that day or the next day. You're actually feeling the way you're feeling at the moment. You're actually feeling quite down when you eventually come to see us, but we can actually see a bigger picture, and it may well be that we can give you some advice that please go to your GP at the moment, because we're actually thinking about when you feel a little bit better, how it may have affected your course, and we want to make sure that you have had the support that is available for you, but also in terms of extenuating circumstances, perhaps maybe you would benefit from taking time out from university to get better, to concentrate on your health, and all of these things we can give you advice on, or signpost you to the appropriate professional who can support you. Okay, so obviously our graduate entry medical cohort are slightly older than the undergraduate school leaving cohort, and we know that, and we have there's lots in the literature, and we've learned lots in the past 12 years about the specific problems and the issues that they may well encounter. Most of them come about because they have dependents, or they support other people. So for instance, sometimes they have children, sometimes they have elderly parents that they have to support, and they've usually set up households as well round about Derby or Nottingham, with the anticipation that they will be throughout the deanery. So we do actually give them quite a lot of transition support. So we have clinical sub-deans come over and talk to them. We have some lectures in GEM to help with the transition. We also engage in our GEM students who have gone through the process as well. On our website we have stories of life as a CP1 student, life as the day in the life of a student on clinical practice, things like that we have. But also what we do allow is that for students who have, say, young children or extenuating circumstances, we ask them in advance of starting CP1 to tell myself or to tell the clinical sub-deans of these situations, and they can actually be considered independently of the whole cohort to see if we can actually place them where it would be easier for them. So for instance, someone with young children who are at school in Derby, they will not be allowed to have all their training in their clinical practice at Derby, but it may well be that it's deemed reasonable that they have CP1, which is the longest rotation in Derby, and then they come to Nottingham City Hospital thereafter. So we do try and accommodate.